Thank you for joining us, and I'll just introduce myself. I'm Catherine Ornstein. I'm at Johns Hopkins University, and I co-lead along with Dr. Philip Sloan, who's also here. Okay, so just so people understand what StARS is before we discuss the grants, it is a 5-year cooperative agreement, and it is funded by the National Institute on Aging. We just started in the fall of 2024. And the goal of StARS is to assist states and organizations to examine and advance the accessibility, affordability, and effectiveness of dementia care services. And we really are hoping to foster improved data infrastructure on dementia services, with the idea that we can share best practices and policies across the country. I think many of you may have attended last week's StARS information session, where we talked about the Learning Collaborative and other StARS programs. Next slide. And we have a large team of people involved with StARS. So it's really a big operation. Many of our leaders have joined us today. I also want to highlight this is a cooperative agreement. So we have 2 colleagues from the NIA, Dr. Fazio and Dr. Novak, that are also part of our leadership team. So today, next slide, we are going to be talking about our grants. And that is really coming from the Research Innovation Core team. So there are many of us on this team. Again, we are a fairly large operation running this. And in addition to leading the project, Phil and I have a lot of folks in the background and on the scenes supporting us with expertise in economics, geriatrics, communications, biostatistics that will help us foster and support the dementia research grants that you will hopefully submit to us. Next slide. So the Dementia Care Innovation Grants. That's what we're here to talk about today. And our hope is by the end of the webinar, you really know how to submit them, what's involved, what are we looking for. So the goal, again, is to advance dementia care services through innovation and research. We want to shape future policies and make changes this way. You will be able to access funding up to $100,000 in direct costs. In addition to that, you will receive support from our experts to help make the project run, to sort of support you in research design, as well as setting up your data and really thinking about how to make your work successful. There's potential to collaborate with states. It's really a state-focused initiative, but other organizations who work closely with states are certainly welcome to be involved. We are looking forward to people and organizations collaborating. Next slide. So key dates, I am going to show this slide again, but I know this is a lot of everyone's questions. The LOI is out, the letter of intent, and it is due on May 23rd. We will select LOIs to invite for full proposal June 6th. So Dr. Sloan will go through the LOI process, and we've tried to make it as simple and direct as possible because we want people to submit these LOIs, and then we will invite you to submit a full proposal if selected. So those are due August 1st. You will be awarded your grant by September 15th, and the project start date is October 1st. These are 1-year grants. Next slide. So there are many things that can be done with these grants. These are research innovation. Just a few example topics are areas that we're interested in, but really do not limit yourself to these topics or these specific types of projects, but thinking about care coordination, potentially evaluating existing care coordination services around dementia within your state. Also, potentially thinking about caregiver resources. How are they used? Are there any barriers related to language, location, or technology issues for caregivers that we can understand, collect data on, evaluate? And also work around cost and quality. So we can do work in estimating benefits and costs for things such as respite care or other programs that your state may offer. Next slide. So again, $100,000 in direct costs. Up to that, you do not have to request all of that depending on your needs. We also will support 10% indirect costs. And again, this is a one-year project timeline. So part of what we are considering is whether or not you can complete the work within that 1 year. And also, we're not just handing you the money and saying, go do it. We also will be having monthly meetings, as well as in-person site visits. The goal being not to create more meetings, but to actually support the work that you're doing and allowing you to leverage some of our expertise so that your work can ultimately be successful. And that is, again, from all of the members of StARS that we showed earlier. Next slide, please, Brian. Okay, I think we're going to just go back one about eligibility. Open to all state, county, city, tribal governments, as well as nonprofit organizations, higher education institutions. And again, collaborative applications are allowed, but we do ask you to just designate one lead organization. Priorities are given to basically organizations involved in statewide dementia service provision and coordination. Again, that's our key focus here in StARS. We also are interested in supporting access to data. And so because of that, we're interested in projects that provide opportunities for data linkage and sharing. And we'll talk a little bit more about that as we go through the application. So I'm going to pass it on to my colleague, Dr. Sloan, and he will do a step-by-step of how to complete the LOI.
Thank you. Thank you. Well, now we're going to talk about the specifics of the letter of intent. We've tried to make it not too burdensome for you. So the application itself consists of 10 sections, and then in the next slides, I'll briefly explain each section. Every section has a word limit to help lower applicant burden. So here's section 1. Here, in 150 words or less, we ask you to provide a brief overview of your project. This is your elevator pitch, how you would describe it to someone if you were riding together up to the 5th or 6th floor in an elevator. A few sentences in which you briefly touch on the why, the what, and the how of your proposed project. Next, please. Section 2 asks for information about who's making the proposal. It notes that projects should be conducted in and about dementia services networks in one or more states. And it asks specifically what state or states will be studied, what organization will be the lead organization, and who within that will lead the effort, plus any partner organizations that will be involved. Next, please. Section 3 asks for more detail about the lead organization, specifically how your organization is involved in dementia services within the state or the states. It allows inclusion of a table or graphic if that's helpful in describing the various dementia services resources in your state that are targeted for study and kind of where your organization fits in. Next, please. So Part 4 asks applicants to briefly explain what your proposal will target in terms of dementia services provision and coordination. In other words, what gaps or challenges in service provision your project will seek to understand and address. Next, please. Section 5 invites applicants to briefly identify and explain one or more goals that the project is addressing, if funded, and which you will seek to accomplish. Next, please. This is kind of our longest section. Here we ask for an overview of the activities you propose to undertake to accomplish the goals listed in the previous section. Here we provide 500 words, as we'll want to see short sections about the population to be studied, the data sources to be used, the study measures, and the analytical plan. This is not a whole thing, but some of the broad picture, so we have an idea what you're proposing to do and how you're going to do it. Next, please. As noted earlier, one goal of the StARS Center is to provide access to, there's a lot of words here, to provide access to and promote use of data about state dementia services programs. So this section asks for more information about the data you plan to use and the potential for sharing it. Now, essentially, we want new projects to benefit from the experience of other states, and through these projects and other activities, we hope to create data linkages and data sharing that will make it easier for states to compare with, share with, and learn from other states. To the extent you can do this within the bounds of applicable regulations and laws at the timeline of your proposals. So please note we have a data core that will be available to help you with this if your letter of intent is selected to move forward. And on this webinar, we have one of the data core members who is here to respond if you've got specific questions. Next, please. This is part 8. We note that improving access to services is another goal of the StARS Center. The reason is because within states and across the nation, not all needy individuals and families have adequate access to services. So these can be due to geography, social determinants of health, or other factors. So in this section, part 8, we ask applicants to identify how your project can identify and impact access to dementia care services and supports. Next, please. Section 9 asks for an overview of your planned budget. Not in great detail, that would come in a full proposal. But we'd like to know in general how you envision spending grant funds and what additional or in-kind resources may be available. What's most important to us at this point is to see whether there's a good match between what you are proposing to do and the resources you envision having available. We allot 200 words and provide space for an optional spreadsheet here. Next, please. So this is our last section, and it's about how we can help you. We're available to provide some consultation as you put your letters of intent together, but if your letter of intent is accepted to submit into a full proposal, we really would like to engage with you to help make it as strong as possible. So the StARS Center has experts in research design, data management, analysis, project evaluation, as well as expertise on dementia services and statewide services in general. So if your letter of intent is accepted, we'll make our expertise available on a consultative basis to help you craft your full proposal. And so here you can put just ideas about how you think you might want to use our resources if you were developing a full application. So next, please. Finally, we provide a blank page for you on an optional basis to tell us anything else you want to say that you feel would be important for reviewers to consider when reviewing your letter of intent. Next, please, and I'll turn it back over to Catherine.
Wonderful. Thanks, Phil. So how will these be reviewed? We will all, the members of our team will be reviewing these. And basically, we're looking at feasibility. It's a big part of this, right? These are one-year grants, partnerships. Who's working on this? How are they working together? Data availability. Is this something that we have the data to do that's usable, as well as policy and the practice impact of the project overall? And again, the budget, as Phil mentioned, is important. Can this be done? And again, we will be giving priority to projects where the data can potentially be shared or used by others in the future, or really that others can learn from the formatting of the data and how it's been used as well. Once we select the letters of intent, they will be invited to submit full proposals. And from that point, there will be pre-application consultations. So at the point your LOI says, yes, this sounds great, we don't expect you to know everything and all the details upon when you have that, when you give us the LOI. We'll work with you a little bit to help you get reasonable application, maybe deal with some of the issues related to data or the methodological issues that may be more challenging to your group. Next slide. How to apply. Okay, we have a QR code that you guys can scan, and it'll take you right to our funding page, which is, of course, on our website. And again, deadline is May 25th. Next slide. Contact us. These are questions at any time. You can ask questions about this grant initiative, as well as STARS in general. You can just use the STARS Center at umn.edu. We also will be holding virtual office hours throughout the month of April. And you can, again, use this QR code or click on this link. It will be on our website, and we'll post it as well. And you can directly schedule a meeting with myself or Phil to just talk through your LOI before submission if we haven't covered any of your questions. Next slide. As promised, here are the key dates you need to know. First thing I'll say is we are doing this all again on Monday, a technical webinar. You do not need to attend that one as well. You certainly are welcome to, but we really just want to get as many people as possible to hear about what we're doing. So that is on Monday. And then again, office hours, those are the dates. If we are not able to meet with you during those times and you still want to talk to someone, just send us an email and we'll certainly be able to respond and find a time. Again, our goal is to help you with these. So we are available for that. And again, the next big date for you to think about is the LOI for May 23rd, but also think through the start date of the project, which would be October 1st in terms within your organization's timeline. So with that, I'm going to keep these dates up, and we are going to answer questions now. And I know there's quite a few in the chat, so we can go ahead and start to answer them. And please just keep putting more in the chat that you have, and we will try to go through all of them. We have plenty of time. So the first question is about whether we can support topics related to direct care worker training. The answer is yes. That is a very important issue in dementia care. We would love to see proposals around direct care worker training. That's again relevant to your state and how we can improve.
Okay. I'll take the next one. Our nonprofit serves people with dementia virtually across the country, not limited to one state. Does that qualify as providing services statewide? If you focus on one or a couple of states, yes, but the focus of this organization is really on, and you'll have to really talk about how you fit in with all the other services within the state, because really thinking about this, there is so much of dementia care coordination that happens at the state level. That's really our focus. So the answer is maybe.
Yeah, and I would say that's something we could discuss with you to see if it could work. Next question is, are university researchers expected to apply if we work closely with the state? Yes, you can apply as partners, I would say, right? To make clear, you have to choose one lead organization, but I would not expect a university researcher to apply on their own. I would expect them to have a state partner that they're working with, and individual international colleagues can apply a consultant, I guess, on your project and take funds that way, is my understanding. But we would have to discuss with NIH, or let me have Regina weigh in on that.
I was just going to add to Catherine's response that there are some exceptions because this STARS team is so large and many of us will be part of the selection process. If you are part of a university that is represented on our STARS leadership team, you are not eligible to apply. So that includes University of Minnesota, Johns Hopkins, Emory, UNC Chapel Hill, and I forget Brown University, and UPenn.
Thanks, Regina. Yes, and so if you are, have an amazing colleague who is involved with your work and who's part of those universities, they cannot be named on this proposal just because we are trying not to have any conflicts in choosing from this process. But if those people and one of us, that's okay. They cannot be listed on here. They certainly cannot be a lead organization, and that's not, they will not be considered.
Okay. The next one says can a collaborative of nonprofits that serve people with ADRD in different regions across the state apply together? Absolutely. States, as you know, services in the states are provided by a combination of what the state itself, the governmental entities do, and what nonprofits do. So yes, and ideally, the more you can show how you'll pull things together, the more attractive it will be. The next one is there a number of LOIs that we accepted? We haven't really decided that. But I'm going to stick my neck out and say, well, the maximum we can fund is 4. And so I'm guessing that something like 8 would be a nice number. Wouldn't it be nice to know you have a 50% chance of getting funded if you put all the work into a proposal? So we're trying to make the LOIs reasonable size so that those who get accepted really can feel like it's worth the effort. Any comments from others, like Regina?
Well, I would just point out that StARS we have a 5-year grant that we received. So it is possible that LOIs that are not funded this year or, don't go to the next stage, or if you submit a full proposal and we're really tight, we have 5 amazing proposals that will be heart-wrenching, but it's possible that we would then encourage you to apply the next year with that, and you could be funded the next year. There's a question about indirect cost rate flexibility. No, everything is 10% is what will be the indirect rates for these projects.
Next one says, good morning. If this funding were used to develop something like a certification program, are there any restrictions on charging a fee for the program after the grant period ends to support sustainability? Oh my goodness, no. Sustainability is something we'd like to see. We haven't built it into the LOI, and because when you're just conceptualizing a program, it's kind of hard to, but if you can talk about it, whatever can encourage sustainability, I think we would like to see.
So can the services be offered regionally and not statewide? So this is about states. So if you're serving a region, I think similar to the other question about sort of national organizations, we would think about which states you are serving. Potentially you could serve, California and Oregon and Washington State, for example, and you could do a comparison within those states.
How about within a state like, for example, Northern California? Would that be okay?
I think so, yes.
Okay. Next, can an LLC who serve underserved communities be allowed to apply for this grant? LLC is by nature for profit, and I'm pretty sure the answer to that is no. Regina, do you know? Catherine?
Well, we have said that for-profit organizations can apply to partner in this with this.
But as leads, can they be leads?
I don't believe they can be leads.
Well, we'll have to kick that one around our leadership and make sure we give a definitive answer online.
I don't think we have a restriction on for-profits. However, I don't believe that NIH allows fee, and the indirect rate is set, and there is not fee allowed on these grants because they are issued by NIH. So if that somehow works into your calculation about whether a for-profit should be a lead, that might help answer your question.
There's a question about whether access and efficiency of diagnosis is a topic. And I think yes, as long as that we could see how this is appropriate relative to people accessing dementia care services and the care that they need.
Next question says, it's really a very specific one about an organization in Southern New York State that is regional, but has worked on statewide initiatives to develop best practices that would be implemented across the state, but don't provide care for, I'm guessing, individuals and families across all of New York. Would that be eligible? I see no reason why not. We can accept regional proposals to the extent that they can generalize to the state. That's probably ideal, but no reason to say no to that general idea.
The next question is about whether the grant is limited to secondary analysis using specific large data set, or is it also supporting studies that involve data collection? Well, the answer is the grant is limited to 1 year. So it matters what you are able to do and what is feasible during that time. So starting something totally new and collecting that data and then analyzing it and evaluating it during that 1 year period may prove to be very challenging. But if there's something that you're already launching and you expect by October 1, it's well under its way, and you really want to start collecting that information and evaluating it, then that's certainly possible.
But secondary data is fine. Don't need primary data. Okay. Next is a confirm yes. There'll be 4 projects accepted at maximum. And if we don't have 4 good ones, well, then we don't have to accept 4. But that's our goal.
So I think there's another a question about the issue about sort of the regional coverage of multiple areas of our state. I think what we've determined is that is appropriate. It is about the state. So that is okay, similar to the Westchester, New York question. Probably we might give some preference if an entire state was being covered and supported, but if one could make an argument about the region that they serve and why it would be important for that state and the work that they do, they would also be considered.
Next question asks, is there a limit about the care setting of the population? For example, nursing homes, community. We do not specify that. Persons with Alzheimer's disease and related dementias are cared for in all kinds of settings. And so from a state policy perspective, all settings are worthy of consideration, and the totality is of particular interest, but I think there's no limit whatsoever.
Does a public university have to have a state partner? We want to see that there is support from an organization that provides dementia care throughout the state. So if that's something that's within your university and that's sort of happening already, then no. But we do want to see that those who are providing care and serving individuals with dementia in your state are included in this process. I don't know if others want to weigh in on that question.
I think the answer is just yes.
Or that.
I don't know. We'll we're partners with state bold initiatives in collaboration with HRSA grant recipients strengthen a proposal. Anything that augments the resources available. We realize that $100,000 may be a lot if you're going to buy a car, but if you're trying to deal with dementia services statewide, it's not. It has its limitations. So the extent that you've got other resources that you can build upon with this, that strengthens the proposal. Yes.
I'm looking at the next question, which is the big one. So I think that one might be very specific. So we may want to just sign up for some office hours and really talk about what that specific need and question is, which is totally fine. I'm going to just move on since there are other questions.
Could I just make one comment about that? And that is that we know that states develop dementia care plans, like state plans for dementia care, like this 5-year plan that they're talking about. And to the extent that a proposal builds on the dementia care plan, that would be seen favorably, because this plan is designed to address the same type of thing we're trying to address, which is statewide service provision. But in terms of specifics, I think we'll just have to go online about that.
Are there considerations for geographic representation and funding decisions? We do not have a specific line for that in our review process, but we certainly don't only want to fund, every state in New England. So we do want to see diversity, and obviously rural areas have some very important needs in dementia care that we would love to see folks try to engage in.
The next question is really a networking question, but it does raise the issue about, I don't know the answer to this. How do folks who are interested in applying find others who might be within the same state?
I think that's a great point, and we would love that. We'd love for people to do that, because we're not going to fund two grants from Montana. So we can certainly make the connections as much as we know about them, but we do have the StARS Learning Collaborative, where we are trying to come together and support individuals about what other states are doing, different activities. So within that, if you are interested in finding a partner, I think what would be great is reaching out to us about that, and we can see folks' willingness to have information shared with those we know. Regina, do you want to add to that a bit?
Yeah, I think that Catherine and Phil are at this email, starcenter@umn.edu, are your best bets for connecting with folks within your state. We would definitely encourage that collaboration within your state.
And if we don't know, we have a lot of folks within the StARS program who have lots of connections statewide. So we would reach out and try to help if we could.
Right. If you have a great idea and something you want to do, then we want to see that happen. That's our goal. Similarly, I would say if you wanted to do a comparison study with another state, that's also something to think about. So, that, and we would welcome those applications too. So if you were doing something and there was a neighboring state you were really interested in comparing a new program to, then please let us know, and we'd love to facilitate those partnerships and research ideas.
So it looks like we're at the bottom of the list of questions, at least for now. And so maybe we should, is Nora the person to let everyone know what to do, how to pose questions afterwards?
I would post any questions to starscenter@umn.edu.
There you go.
Right there. It's up there. That's where you post your questions, anything. And we also have the link there we can send out to sign up for office hours after we end this webinar. that you can sign up to chat with us, you know, because there's a lot of, I'm really excited, actually. There's a lot of great ideas and brainstorming happening. And so Phil and I would love to brainstorm with you about kind of what could work, because there's still plenty of time. May 23rd is, you know, there is a long time to kind of come up with new ideas and find partners for this project. But if there are no further questions now, we can stay on for a little bit, but otherwise.
So, I see 2 new questions.
Oh, got it.
Yes, the caregiver health is a huge component of dementia care. So absolutely, we are interested in caregiver health issues. That would be completely appropriate.
Next question, Catholic organization. It's a nonprofit organization. If they provide dementia services, absolutely, yes. Ideally, partner with others, unless you are so involved at a state level that you want to go your own.
And there is a question about sharing your abstract. I think that would be fine. I would actually encourage you maybe to set up a meeting with either Phil or myself, the office hours there, you know, and then we can discuss it. That's probably the easiest way if you have an abstract. But yes, we're happy to talk to you prior to submission and help you make sure you're on the right track.
Although I'd be honest, it's better to think of the abstract in terms of the letter of intent sections as opposed to a traditional abstract, because that's the way it'll have to be put together and that's the way we will think about it. So our abstract is 150 words. It's basically our elevator pitch, which is a lot less than your typical abstract. But we're trying something that we're trying to make it less NIH-like and more like many of the providers within the state are more accustomed to. So we'll see how it works, but anything you can share, we're happy to take a look at it.
And as a reminder, we will send out a brief survey. Thank you for helping us do a good job with this. That's our job, is to make sure we're providing you the information you need. So we welcome any feedback in that area. And if you know,
I'm sorry.
we'll post this and there will be another webinar on Monday. So if you have other questions, you can share them then, and that would be wonderful.
One more did come in. Oh, they keep coming. Yeah. So this is a good one, because I have to think about it. Is the funding priority focus on dementia or on the services provided by state agencies and related data elements? Well, the two are kind of intertwined, but it's really about how people with dementia and their caregivers, particularly family caregivers, receive services and obtain needed services. So it's on both, really, but it's dementia care services.
Mm-hmm. Yeah. And a Dementia Friends program, if this is a program that is serving patients with dementia and is improving their lives and their families' lives, then it certainly is within the realm of possibility and interest. You just need to tell us what the program does. Okay, I'm waiting to see the questions pop in. Oh. VA-related foundations. Oh, sorry, it is your turn, Phil.
That was fine for you to take it. Anyway, VA-related foundations, they're nonprofits, they're eligible, certainly, and within a state participation by multiple organizations, particularly now, they need to be involved some way in dementia care and dementia care services. But I think that kind of goes without saying. Mm-hmm. Well, one thing I wanted to say, because we've gotten different, could we do this or could we do that? It could be this. And as you're thinking about what you would like to do, also look at what our priorities are, what our goals are in this program, because you want your proposal to match both what you want to do and what you see as a need and some of the priority areas that have been identified in our on the website.
Are there any questions about data and data sharing? Okay, so pop things in the chat. We'll stay on for a few more minutes, but otherwise think about it and keep asking your questions, and we will keep sharing the questions and answers with everyone.
I would add just thank you so much, all of you who attended, for your interest and your interest in this important area. And we hope this has been helpful.
Yes, thanks everyone for your enthusiasm and interest. We are very pleased. I see that Eric is typing a response around data and data sharing, and that is just, and we want to make sure that people understand that that is a priority in what we're doing, and we are happy to explain that in more detail, but we will be considering what data you are collecting and whether it's the kind of data that others can use, others can learn from, that could potentially be supported, made public, obviously given within security limits, requirements. But that is something that we are very interested in and is a priority for the NIH in having this. But we have an entire team that Eric leads where we, help make that happen. So it's secure. So it's not something to sort of be alarmed about, but we are, really wanting to make that a priority. Eric, I'm happy if you want to say anything else.
Yeah, well, you saved me from writing an essay, so thank you. Just to reiterate some of Catherine's key points, and point of emphasis is on data sharing, but the data core, which I co-lead with Callie Thomas, one of our core tasks is working with funded groups to come up with reasonable terms for data use agreements that you will control in terms of how you share data with external individuals in the future. So we will be here to work with you and help you think through the ways in which you can or cannot share data according to your own organization and also according to the goals of StARS, which again is to kind of share information with the broader research and policy community going forward.
Thanks, Eric. And I think that addressed some other questions about data sharing and that we're seeing come up. The NIA linkage program, for those that don't know, is really something exciting that NIA has recently launched, which allows for a secure environment for data sharing. And many existing, a lot of Medicare data and so on that is linked to other data sources and surveys have already been put onto NIA linkage. So it's a really exciting way to make data secure and to share with the idea of expanding research opportunities. So we are not necessarily, we want that to be a consideration in projects moving forward.
Yeah, and I'll just add one of the strengths of NIA linkage is the linkage people will work with you to link your data to CMS data products. And that's a resource that would be free to any sort of individual who wants to take advantage of it. So it provides really good infrastructure for linking to CMS products. And then the other benefit of linkage that Catherine mentions is it provides a secure environment that you could then share out files with other research groups who meet your DUA requirements. So it's a really nice resource. It is not required, but I think strongly encouraged to try to take advantage of it as an opportunity.
Thanks, Eric.
And to answer the earlier part of that question, I don't know if Eric, you wanted to talk about this, but since I'm here from the Administration and Dissemination Core, we do hope that grantees, the individuals and entities that receive a research innovation grant, will be willing to share their findings. We will do that within grantees, the 4 grantees, but we will also do that through our learning collaborative. So there may be other states, sub-state entities, providers, researchers, who want to learn more about what you found with your 100K Research Innovation Grant. So we will be holding learning collaborative meetings in which we share findings, in which you share your findings from your project, because the whole goal of StARS is not necessarily to reinvent the wheel and create 100 more different integrated and coordinated dementia care programs, but rather to share what does work and allow other locations or provider types to scale up what we know already works, and to create policies to advance the reimbursement and the high quality care services that those integrated and coordinated care programs serve. So we will be facilitating that kind of sharing and learnings through the Learning Collaborative.
Thank you, Regina. Eric, do you want to answer the question about the time lag?
I just wrote in the chat, I'm going to have to follow up directly with linkage to confirm, but my general recollection is that they receive files at the same time that everybody else does. So it kind of depends on, I guess, when the data you would be linking and when it was captured. If it was historical data, that might not be as much of an issue. If you're doing real-time data collection and then aiming to link up with CMS files in real time, that may or may not be feasible. But we'll take a note to double check with linkage when they get files available and send out a note.
And I just sort of want to highlight, and it's really exciting to see these great questions pop up, to know everyone's thinking about things, that if your LOI is accepted to move forward, you will be able to meet with Eric and his team to sort of think through some of the data issues, what you would have, this sort of at the LOI stage, you would have a general idea, but we really could work through some more of the details in terms of what you would want to do before you get to your final application. So that is part of what we're here to do. So you can, get creative and think about the kinds of things you'd really like to do, and we can help you understand what's possible. I also see that there's another request to sort of connect people. So I love that. And I think what we will do is put some more information on our website about that. Please, for now, email our StARS email if you're interested in finding more people in your state and so on, so we can help make those connections moving forward. Okay, well, with that, I feel like it's like popcorn, waiting for the final kernel. But we just have a few minutes. So I just want to thank everyone again for your time and your questions and just being engaged in this. And we are, there it goes, more of them. That we're not releasing yet timelines for the second cycle of funding, but we do have sort of plans for that. Once that happens, we have no concerns around linkage at this time, but obviously this is an NIH funded grant and linkage is an NIH funded service. So there's certainly some upheaval and uncertainty right now in that. but we are ready and prepared to support this round of funding. So that's what we're going to focus on now.
Question about signing up for the meeting on Monday. We're going to go through the same thing on Monday that we've gone through today, but if you want to hear more questions, Nora's typing an answer.
Yeah, feel free to sign up, and especially if you can come up with more questions and you want to ask them live, you want to share them, then please go right ahead. But we're going to do our best to share all the information and questions from today and share them online so that everyone can benefit from this information. So great. Well, thanks everyone so much for your time and your enthusiasm. And we really look forward to seeing the applications and hearing from you and meeting with you. Thank you.